let's just start off right away with where things stand in terms of your ability to produce N95 respirators and get them to the communities in need, particularly in New York, hospitals there, in Seattle, and a couple of other areas around the country.
Yeah, good morning, David. Good morning, Jim. Yeah, that is the top priority for us. Our highest priority at 3M right now is the safety of our people and the public. And our teams really around the world are focused on supplying healthcare workers with the safety products they need. And here in the U.S., we have accelerated our production. Starting in January, we ramped up our production. We had a long-standing decision to invest in excess capacity, keep it idle, turn it on in times like this, and that's what we did. And we've increased, almost doubled our output from 19 million respirators to 35 million a month. And we are prioritizing the healthcare workers, and we are working 24/7 to ship to those frontline healthcare workers. And we continue to work to expand that capacity further in the near term and the long term as well.
Yeah, is that U.S. capacity? You know, I wonder, Mike, there was a period of time, I know, when this crisis obviously was centered in China and the need was there. You have manufacturing facilities there, but were unable to manufacture because obviously people were not coming to work, or at least a lot of people weren't. Is China manufacturing back on, and is that output going to end up back here in the U.S., or how does that work?
David, we actually were able to operate all through Lunar New Year, the extended shutdowns in China. We had special permits to operate because of the importance of the safety products we were producing. So we ramped up in China starting in January as well, and we served the market there out of our production in China. We manufacture these respirators in every region of the world, and China was a great example where our team jumped on it, really ramped up to full capacity, and were able to meet the demand in the local market.
Mike, Jim, thank you for coming on. One thing that was
Morning, Jim.
Yeah, one thing that was disturbing to many Americans was that to see at a Target in Seattle all the N95s you wanted on a shelf. I don't understand how that kind of dislocation occurs where we have the retail market have them, and yet over, UCSF, they run out of masks. Certainly many of the New York hospitals really touch and go. How'd that happen?
Well, Jim, as we ramped up our production, we came into the year, about 90% of our respirators go to industrial customers, sometimes through retail channels in a normal business environment. When you have a crisis like this, we shift everything to healthcare. We were able to do that with the implementation in March of the emergency use authorization from the FDA and also the U.S. PrEP Act. All of that enabled us to shift what are normally industrial respirators, the N95, over to healthcare workers. It allowed us, it gave us the certification that we needed to be able to do that, and that happened. Now, there was some inventory, as you would expect, throughout the supply chain from what was happening even as we came into 2020. So it's not, it's disappointing when you see that because we're trying to redirect everything to healthcare workers, but it's that changeover and that shift, and now everything is going to healthcare workers. We are producing and shipping directly to those healthcare workers around the U.S.
When the when our president contacted you, I believe mid-February, were you able to divert and get as many masks as possible here, or was there just some sort of miscommunication where they did not request what they could have?
Well, we've been working closely with the vice president and the president and now FEMA to get respirators to where they're needed most, and we've been doing that every step of the way. It was this emergency use authorization and the U.S. PrEP Act that enabled us to shift everything into healthcare through all channels. So we have, from the early stages in March, we've been responding and shifting everything to healthcare.
Mike, I want to get to the specifics of the problem here, and certainly a lot of it is in our hometown, New York City. I mean, a lot of people have seen this memo from the chief of surgery at New York Presbyterian. Usually they use 4,000 N95 masks a day. They're up to 40,000. He sees them going to 70,000. Are they going to run out of masks, or are you going to figure out a way, along with obviously the local and state and federal government, to get these hospitals the masks they're going to need? at numbers they've never seen before?
Yeah, David, we have prioritized New York and Washington State, and we shipped over the weekend more than 500,000 respirators into those cities. More than 350,000 are landing in New York today and coming into use, and we'll continue to be able to prioritize and ship. We've arranged, we are working broadly with partners. It's really impressive to see the way companies have stepped up. Many companies are working in partnership with us to help extend our capacity. We're working with other companies to help us in logistics and expedite. We're ready to expedite respirators to wherever they're needed, and New York is clearly a priority in the near term. And we are, as I said, we're getting respirators on the ground there, additional respirators. There are other respirators serving New York through healthcare distribution that we would normally be shipping to, and this is an expedited shipment that's getting there today.
Mike, is there any way to get back, just let's say if you go on right now, I think if you go on Alibaba, there's masks, there's tons of masks. Any way to get the masks from China back, just as a kind of like a Lend-Lease program between China, which is doing so well, and our country, which is obviously bearing the brunt now, with you being the broker?
Yeah, we are working every angle to get additional respirators into the market in the U.S. and bringing them in from international manufacturing locations is one of the examples. We are working to really prepare ourselves for this. We have to ensure that we meet the standards of the U.S. from the products. The standards vary slightly around the world, and so our team right now is doing that. And then as soon as we can bring capacity from international in the U.S., we're doing that.
All right, so what can we do with the other part? You know everything about what goes into a healthcare worker, a doctor right now in an emergency room. What else can we get for them? Because I think everyone in America wants to help these people. We want to help the healthcare workers first. If we can do anything we can, whether it be make it so they don't have to pay taxes or make it so they have a gown, what can we all do to help those people?
Well, we are focused a lot on respirators in our company, but it's more than that. We're working on ramping up additional capacity for hand sanitizers, for disinfectant capabilities. We're working in partnership with many companies. It's amazing how many companies have come to the table with great ideas on how we can work together and even bringing some of the capabilities we have in our broader healthcare business to support them. So I think there's a broad effort and a very focused set of teams that are working to do that right now. I think that supporting them, really supporting those teams is one of the best ways we can do that. Keeping a focus on the supply chain that serves those companies in order to continue to supply into healthcare, that's an important aspect of it. Even what we were talking about earlier, making sure that we have the ability to move products and materials around the world, that we don't see export restrictions come into place. Those are all aspects of what we can do to work together to solve that. So those are some of the things that, from a company and business standpoint, that we're working together to try to bring to the table.
Mike, given your knowledge of what's going on in terms of what healthcare providers need, far beyond what your products are, ventilators obviously being a key one, do you think the president should make use of the Defense Production Act to get needed supplies into the hands of these hospitals?
Well, the administration is encouraging industry to look at the Defense Production Act as a tool to expand our capabilities. And that's the response I've been talking about. We are building on our capabilities and working together to respond to COVID-19, including personal protective equipment, other countermeasures, vaccines, ventilators. I think that's been a really positive part of the way the Defense Production Act has been presented. We're discussing this with the administration ourselves and working to partner in the supply chains. We're working with FEMA to make sure that together we're getting our respirators to where they're needed most. I think all of those are very positive and steps forward as part of the discussions around Defense Production Act. So I think that's been a very positive step in really encouraging everybody to find the solutions and get them to market.
Mike, this is a little bit of an ethereal question, but I know you as a human, I know you as a family person. Between the Dr. Fauci and what I read online, there are some people who feel that 80% of the people in this country are going to get sick. Do you think, as a business person, I can't ask you to be Dr. Fauci, do you think we're all going to get it?
Well, we are focused first and foremost, Jim, on the safety of our people. And so we have implemented all remote working, the social distancing. We're separating our people and really focusing on their safety. We've implemented new operating procedures in our plants as we work to keep those running so we can continue to produce respirators. I would say I think that's the preparation we need to really get to the best outcome here. And that, I think the measures that we're taking now are most critical. This is the critical time to act on those to really prevent those worst case scenarios.
Yeah, and Mike, finally, on that broader point, though, about preparing your company for a significant and steep economic downturn, perhaps the likes of which we've really never seen, you're obviously selling a lot of respirators, but there are other parts of your company that one would imagine would suffer as a result of a slowdown in economic activity. What are you doing to prepare the company for that?
Yeah, we have activated our crisis teams in the company like most companies. And one of the things we do is we are every day looking at the business scenarios and what do we need to do to stay on top of that. That crisis team led by myself and my senior leadership, we are first and foremost focused on our people and on delivering for the public health crisis. But we're also looking at business continuity and making sure that we're considering the scenarios that are in front of us. We are a very strong
Come to me before you go to
financially.
One quick line.
Yep, we are a very strong financial company, so we are really put ourselves in a position to manage through this well.